Okay, so I'm going to enter the patient's room. I'm going to provide patient privacy and verify that we did receive an order to insert a catheter for this patient. I'm going to perform hand hygiene, and I'm going to introduce myself. So hi, my name is Sunny. I'll be your student nurse today. Can you please verify your first, last name, and date of birth? Okay, great. Thank you. So we did receive an order per your doctor to insert a catheter. So upon this catheter, there should be pressure, which is normal. It'll go inside your penis and empty the bladder. So I'm just gonna set this on your bed. So just try to be cautious because I don't want any cross-contamination of your legs touching this. So that's just gonna sit right here. So basically, I'm gonna ask if the patient has an allergy to iodine, which they do not. I'm going to raise the bed up to waist height for my comfort, and then I'm going to ensure that the railing on the other side is raised up. So this is gonna be my workspace. And then, like I said, I did verify that they were not allergic to iodine, so I'm gonna go ahead and get started. Do you have any questions? Okay, that's great. Have you had this done before? Yes? Okay. That makes it a little easier. So I'm just gonna set this bag right here so I can put my supplies in when I'm finished with them. Okay, so sterile field, I'm gonna touch the outer corner, away, the sides, and then back. And then I'm gonna turn it, only touching the outer corner. And then this stuff is just hand hygiene and pre-peri-care, which I already performed pre-peri-care. So that's good, we don't need to do that. And then this is the drape, this is considered clean. And then it's just gonna go underneath the patient's legs. So if you don't mind helping me lift up just a little bit. Thank you. Okay. So I'm only touching the outer corners. Oops. Okay. And then I'm going to go ahead and put on my sterile gloves. I'm only going to touch the outer corners. Shoot. I'm going to do it right here. And the sterile field is still in my view, so. I'm only touching the outer corners. So I'm going to touch the inside of the cuff, fingers down. Okay. And then make sure that this thumb stays back. Okay, and my sterile gloves are on. So now I'm gonna come back over here. And then once my sterile gloves are on, I'm gonna adjust this and then move this a little bit closer to my patient. And I'm touching inside of the border. Okay, so I'm gonna get set up. I'm gonna take off the cap to my sterile water and my lube. Prepare the lube, squirt it out. Just gonna set this here. I'm gonna take this trash off and make sure that the catheter is not fleeing anywhere. So that's good. I'm gonna go ahead and put my catheter tip in the lube. Okay, there we go. And then throw my trash away. And then I'm gonna go ahead and attach my sterile water to the balloon pump. Got that. So now I'm gonna go ahead and clean the urethra with iodine. And once again, I did confirm that the patient was not allergic to iodine. So I'll have you go ahead and lift up your towel for me. Oops. They lifted their towel up. Okay, so this is my non-sterile hand now. This is since I grabbed it. So I'm gonna clean the outside, throw that one away, clean the outside, circular motion towards the tip, and then clean the tip, throw that away. Okay, so now I'm gonna leave my hand here upon insertion. So now I'm gonna grab my catheter and push it in until I see flash of urine. Okay, so I do see urine. I'm gonna go a little bit further, push a little bit further, perfect. Okay, so now I'm gonna take this hand, and since it's not sterile, I'm gonna inflate the balloon. Okay, and now I'm gonna take the balloon off, or the sterile syringe, sorry, and then I'm gonna pull back on the Foley just to make sure that there's tension, and then push in. Okay, and then I'm gonna tape the catheter to the patient's leg, and then I'm gonna put the urine bag at the side of the bed below the bladder. And then just depending on hospital policy, we would go ahead and get a urine sample out of the bag since the catheter was just put in. But if it was any other time, if it was like a day later, then we would have to get it out of the port up here. So perfect. So I am covering the patient back up after I cleaned up my area. Okay, we'll just say that this is clean. I'm gonna go ahead and change gloves and then perform post-op pericare. I'm gonna lower the bed, make sure that the patient's covered and comfortable, and then put the railing back up, make sure the call light is within reach, and then I'm gonna ask to make sure that there's no questions, and I'm gonna go ahead and document how the procedure went. So, and that's that. Thank you.